Good morning, everyone. I'm Carolyn Sawyer, and am honored to be with you this morning for the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We're delighted to have you with us as we address health disparities, environmental justice, and shaping the future of healthcare. And you're an important part of that discussion as we dive into it today. I bring to you on this first dual virtual conference greetings from our Dr. Sabra Slaughter, who is the Senior Advisor to the President of the Medical University of South Carolina in Charleston, South Carolina. He is also the Interim Director for the Center for Health Disparities Research. Again, I bring you special greetings and want to remind you that this conference addresses three overriding themes in health disparities and the role that is played by social determinants, personal responsibility, and prevention. And we'll expand this conversation with so many of our leading experts throughout the next few days. We're delighted to have you with us. We'd love to know from what part of this country or world you're actually tapping into this conference. So please, in the chat area, let us know where you are watching us from. If you have questions, please provide us those questions and we'll try to weave those questions into our discussion and the panel discussions that we have for you today. Again, we have a lot planned for you. We're really thrilled and excited to have you with us. And so we'd like to start with welcome remarks this morning. And the first person providing those welcome remarks is Dr. David Rivers. He is the board chair for the National Conference on Health Disparities. He's a professor in the PICO Academic Affairs Faculty Division at the Medical University of South Carolina in Charleston. Good morning, Dr. Rivers.
Good morning, and I'm glad to join in this discussion today. You know, over the last 12 to 15 years, we've been doing health disparity, climate change, and you name it, to get a focus on where we go with regard to health disparities. And sometimes when you talk to people, it seems like they think we're just getting started with health disparities and moving forward. But I tell you what, we have to thank a whole lot of people to move forward in this regard. People like, obviously, Jim Clyburn, who has played a major role, Melinda Downing, Lloyd Moore, you name it. So we're going to claim it in that regard. And hopefully from the conference today, you'll get some additional information. I know for a fact that recently we just received 2 awards, the Telly Awards. The Telly Award talking about climate change. I got a reaction from 80 million people around the country, and we won the award twice now. So we're feeling pretty good. And obviously we always thank Carolyn because she's always helping out and giving us good read on situations and that kind of thing. And I can't say enough about Melinda. Without her help, we would be nowhere. So again, welcome, I thank you, and let's just get this discussion started.
Thank you so much, Dr. Rivers. And I do want to introduce Dr. Melinda Downing, who has as well welcome remarks for us this morning. She is the Environmental Justice Program Manager at the U.S. Department of Energy in Washington, D.C. Good morning, Dr. Downing.
Good morning. Thank you, Carolyn, for that kind introduction. Good morning, everyone. On behalf of the Department of Energy's Environmental Justice Program and the National Environmental Justice Conference Incorporated, it is my pleasure and honor to welcome you to this year's joint conference for both the Environmental Justice Conference and Training Program and the National Conference on Health Disparities. While we have so many dedicated partners and members of this conference network, I would like to give a warm acknowledgement and thank you to 3 special individuals who have been at the forefront of both conferences since their inception. Without their presence and dedication, the depth of opportunity provided at this conference could not have been reached. First, I would like to acknowledge the Honorable James E. Clyburn, who for decades has fought for civil rights In addition, during the past 14 years, he has demonstrated his leadership in the fields of environmental justice and healthcare. He has provided forward-thinking strategies that have driven these conferences, as well as the Environmental Justice Brain Trust, year after year. He has truly laid the structure and path forward to addressing these environmental and health issues. Secondly, I want to especially honor and thank Mr. Ben Wilson, our chair of the board of directors for the National Environmental Justice Conference Incorporated. Ben's vision and thought-provoking ideas have helped us shape the pathway for this conference. He has encouraged us each year to challenge ourselves to provide the resources and knowledge that our most vulnerable populations need each and every day. And certainly, last but not least, is the gem of the National Health Disparities Conference and a visionary for both conferences, Dr. David Rivers. David has been the champion and idealist for planning and developing the best ideas and concepts for all the right pieces that connect all the hard work and diverse groups of people together to address what we are all striving toward, and that is to enjoy the best quality of life that each and every one deserves. I also want to give a special thank you to Deputy Secretary David Turk of the Department of Energy, who will give remarks this morning on behalf of Secretary Granholm. We are very pleased that Representative Clyburn and Deputy Secretary Turk will be addressing our conference. We are honored that they are dedicated to our causes and that they are willing to share words of encouragement with our attendees. I know that you will find their messages inspirational. Now, for all of you who have taken the time out of your busy schedules to attend this conference, these two conferences provide a one-of-a-kind opportunity for a valuable service to our EJ communities, as well as a voice and seat at the table. With today's environmental challenges, the combined conference plays a huge role in connecting the bridge that divides the have from the have-nots. The combined conference is for your communities, and this is your time to interact and take advantage of the resources that are afforded to you through the sessions for today through Friday. I encourage you to take this opportunity to listen and learn this week, and I encourage you to share this information with your family, friends, co-workers, and neighbors who are unable to attend. Let's keep in mind that not all communities have access to computers and broadband. Bringing this great technology information highway divide is one of our biggest challenges. Until all have access, we must be their link to information so that all our communities can be better equipped to protect themselves and live in a clean, safe, and healthy environment. Again, welcome and thank you for being here and enjoy the sessions. Now we'll turn it over to Carolyn.
Very well said, Dr. Downing. We appreciate those remarks. We appreciate your hard work. We appreciate the hard work and dedication of Dr. Rivers as well. As you mentioned, we have individuals that participate on this conference from all across the world. We have professionals from the private sector, federal government employees, state and local government employees, as well as tribal officials. And so we welcome everyone. I'm actually learning that we have this morning individuals from Virginia and Vermont and Florida and Missouri and Maryland and Louisiana, North Carolina, South Carolina, and China. And so again, we welcome everyone. We say good morning to you, and we are honored and privileged to have you with us today. And we look forward to your engagement in this process. As Dr. Downing mentioned, we have special opening remarks this morning from two very special individuals. The first is the Honorable David Turk, who is the U.S. Deputy Secretary of Energy at the U.S. Department of Energy in Washington, D.C. His remarks will be followed by a special message from the Honorable James E. Clyburn. He is the Majority Whip in the U.S. House of Representatives. He represents the District 6 in South Carolina. So please give your attention to both of these gentlemen.
Good morning. It's a pleasure to welcome you to this year's National Environmental Justice Conference and Training Program in collaboration with the National Conference on Health Disparities. The Department of Energy is very proud to be a founding sponsor of this program, and I'm honored to join you all today. At the Department of Energy, or the Solutions Department as we like to call it, we perform world-class scientific research at our 17 national labs, oversee the United States' energy supply, carry out environmental cleanup of the Cold War nuclear emission, create climate solutions, protect our national security, and so much more. And Secretary Granholm and I believe tied to every one of these missions is justice. Environmental justice and equity form the cornerstone of this administration, and the DOE is committed to incorporating it into every office of our department. In this administration, we understand that the legacy of pollution runs long and deep in communities of color. Research shows Black households are more likely than other communities to live in the shadow of fossil fuel generation, and that because of this, communities of color are also systematically exposed to more air pollution than other communities. This is environmental justice, and the clean energy transformation that we're all working towards can not only make these communities clean and safe for families, but it can also make our energy supply more reliable and more resilient at the same time. Prior to the COVID-19 pandemic, 1 in 3 US households faced some form of energy insecurity. This forced 20% of households to reduce or forgo basic necessities and caused 11% of households to keep their homes at unhealthy and unsafe temperatures in order to pay energy bills, all the while facing constant threat of utility disconnection. During the pandemic, these numbers skyrocketed. 25% could not afford to pay their energy bills. 25% received disconnection notices, and 10% actually had their utilities disconnected. These real-life personal effects of environmental injustice and energy burden are directly tied to how our energy system was designed. The recalibration of our energy system requires a transformative commitment from all of us to target disadvantaged communities for clean energy investments, new jobs, new business opportunities. That's why at the Department of Energy, we are absolutely committed to the President's Justice 40 initiative, which is led by the infallible Shalonda Baker, Deputy Director for Environmental and Energy Justice and the Secretary's Advisor on Equity. The Justice 40 initiative requires 40% of all benefits of certain federal investments, including investments in clean energy and energy efficiency, to flow towards disadvantaged communities. In May, DOE released our Energy Justice Dashboard to track and manage DOE-specific investments and benefits related to the Justice 40 initiative. This dashboard serves as a tool to provide internal and external stakeholders visibility into our progress here at the department towards the Justice 40 initiative. It's a crucial part of both showing and tracking our progress towards this important goal. I want to highlight specifically 2 of the investments we're making in frontline communities right now that have us all very, very excited. The Inclusive Energy Innovation Prize and the Community's Local Energy Action Program, or LEAP for short. The Inclusive Energy Innovation Prize aims to fund organizations for activities that support underrepresented and underserved communities with business and technology, incubation, acceleration, and other innovation services in climate and clean energy technologies. The prize is particularly geared towards colleges and universities that serve large populations of students underrepresented in STEM, including MSIs, community colleges, and predominantly undergraduate institutions. Our Communities LEAP initiative is designed to help environmental justice communities and communities with historic ties to fossil fuel industries take direct control, active control of their own clean energy futures. The Communities LEAP pilot program provides supportive services valued at up to $16 million to help communities develop locally driven energy plans to more effectively leverage public and private resources to reduce local air pollution, increase energy resilience, lower utility costs and energy burdens, and create good paying long-term jobs. DOE's Community LEAP reflects the Biden-Harris administration's goal to assist community-led transitions to a decarbonized economy and to build a healthier, more equitable and sustainable future for everyone. We believe clean energy is a doorway to a healthier and more prosperous future, but for too long those doors have been closed to many of our nation's communities. President Biden charged this administration and our Department of Energy with taking bold action to tackle the climate crisis and to center that action in equity. And the Department of Energy is a key partner and leader in that effort. Before I go, I want to especially recognize a key advocate and supporter of this conference, the Honorable James Clyburn. Thank you, Congressman, for your support for environmental justice and your service to our nation in so many ways over so many years. This conference is a forum for you to raise environmental justice concerns and your ideas for addressing these concerns directly to various federal leaders. I encourage everyone to be open, receptive, and actionable in these critical conversations. Thank you for being part of this incredibly important dialogue on justice, on fairness, and equity, a dialogue that must uplift all Americans and help us continue to be an example for the rest of the world. Thank you.
I am pleased to welcome all of you to this joint session. Living through a pandemic such as we have not seen in over 100 years is proven to be quite a challenge. COVID-19, as many of you know, has brought on some significant emergencies in families, in communities throughout this great nation. Many of you have been with us for a long time. For more than 20 years now, we have been equating environmental justice issues with health disparities. And that's as it should be, because they go hand in hand with the challenges it takes to overcome such things as we're now faced with. Not just COVID-19, but recent weather-related disasters are proven to be a bit of a challenge also. And so several years ago, when we were faced with some similar challenges, nothing like a pandemic or even an epidemic, but challenges regarding trying to confront the environmental justice issues that exist in communities throughout the country. I took on the task of sponsoring an environmental justice task force and having a session at our conferences, that is the Congressional Black Caucus conferences, every year. I looked around for someone with a record in this field that could help us not just get started, but help us sustain an effort to address these issues. I found that someone in Dr. David Rivers. I'd known David for a long time, but I had never really worked with him. Working with him in this effort has proved to be one of the highlights of my professional and personal career. David's background in this field is one that all of you are familiar with. Not only has he addressed these issues in a very meaningful way, but he has educated his community there in Charleston, as well as the state of South Carolina. Putting this together helped him launch these national events that we held in various places across the country, addressing the whole issues of health disparities and environmental justice. He did a yeoman's job, and I thank him for not just helping this group understand the force that it could be in this very critical area, but helping me personally develop a legislative agenda that has served me well, but served the Congressional Black Caucus in a very meaningful way. I also want to thank those who have been a part of his team. You know who you are. For fear of leaving some out, I'm not going to call any names at this moment. But thanks to all of you for doing that which was necessary to get us to where we are today. This has been a real journey of love, and I do believe that you are going to leave let's just say, a record to be emulated by those who will come after us. So have a good conference. I wish we could all be together in person, and maybe that will happen next year. But until then, let's do the best we can with what we have and continue to do good work for the American people, and continue to hold the Congressional Black Caucus and your efforts in high relief. Thank you and Godspeed.
Thank you, Congressman Clyburn. To think that this is all part of his vision for healthy communities all across this country. I should note that MUSC's PICO program has collaborated with Congressman Clyburn for the past 22 years and conducted the Environmental Justice Brain Trust, which are 2-hour programs that are convened during the Congressional Black Caucus annual legislative weekend. So if you're in Washington around that time, do check that out and support. I also want to thank those who are watching and participating. Again, this is an interactive dual virtual conference, and we invite you to offer your suggestions. We received one chat that says, thank you to the Honorable Turk for these important opening remarks to ground us today. And we echo that. We thank him for those remarks. And this has indeed been a journey of love, and much thanks to the Congressman for having the vision and following through on that vision. We've now come up on time for us to take a break. We're going to take a break as we pull together our panel members who are part of panel 1. Today we'll have panel 1 as well as panel 2. Panel 1 is understanding the relationship between health disparities and environmental justice, especially during this time of COVID-19 and the pandemic. Many of you perhaps saw that, in fact, Dr. Anthony Fauci made remarks, he of course being an immunologist, who said that COVID-19's response in the United States says that the undeniable effects of racism have led to unacceptable health disparities among African Americans, Hispanics, and Native Americans during this pandemic. I'm sure we're going to hear a lot more about some of the outcomes and results of what we've seen happening during the pandemic. So you definitely don't want to miss our panel 1 that'll be starting very shortly. We're going to take that short break, and we will in fact be back. So stay tuned, don't go too far. We look forward to you participating and continuing the discussion today in our dual virtual conference. Hello, everybody, and welcome back. Welcome back to the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We are so happy to have you with us. I'm Carolyn Sawyer, your conference facilitator. And as I indicated before we took our break, we have 2 panels today, panel 1 and panel 2, and we actually have our panelists together for panel 1, and we're ready to get started. So we hope you are ready for panel 1. I'd like to introduce this panel, which will be discussing the understanding of the relationship between health disparities and environmental justice, especially during COVID-19. We are honored and thrilled this morning to have as our moderator of this particular panel, Ms. Karen Dell. Ms. Dell is the market president and the CEO for America's Caritas, which is in the District of Columbia in Washington, D.C., where she's located. So we welcome you, Karen. It's so good to see you. As I said, you've been a longtime friend and partner of the conference, and it's great to see everybody back, even if we're virtual, but we'll take it. So we've got great information, and I'm going to turn it over to you.
Absolutely. Thank you, Carolyn. So today's topic of conversation will explore how the pandemic exposed health disparities among individuals based on race, income, location. Also look at how the pandemic continues to widen gaps of disparities in the COVID-19 response, treatment, and vaccination rollout. And this conversation is more crucial than ever. In this era of recovery from the COVID-19 pandemic and throughout the past 20 months, data has been gathered, performance has been tracked, looked at outcomes of initiatives, and responded to the pandemic. However, we need to ask ourselves, is that enough? Today's conversation will help walk us through some of the challenges so that we can learn, plan, and do more. So thank you, panelists, for joining today's conversation and sharing your experience. A housekeeping reminder for the audience, each panelist will have 10 to 15 minutes to present. And then if you have questions, be thinking about those while they're presenting, and please put them in the chat. And then we'll refer to the chat at the end in order to give the panelists an opportunity to answer. So let's jump to the panelists and their introduction. First panelist is Dr. Tom Ellison, joining us from Birmingham, Alabama. Dr. Ellison is the Medical Services Director and Principal Investigator at Project Help USA. Joining us from Washington, D.C. is our second panelist, Dr. Kim Lambert. Dr. Lambert is an environmental justice coordinator with over 2 decades of experience working with the U.S. Fish and Wildlife Service. And then our third panelist is Mrs. Lathryn Woodard, joining us from Columbia, South Carolina. Ms. Woodard is the Chief Executive Officer of the South Carolina Primary Healthcare Association, with over 30 years of experience working within the organization. Again, so honored to have each of you, looking forward to hearing from you. So let's go ahead and jump in. Dr. Ellison, you may begin.
Thank you. Good morning. My topic is SARS-CoV-2, the inequity affects you. And I'll qualify that with this statement. A month ago, I was here in DC. USA Today asked me about ICU beds in Alabama. Most of you know that we're at the bottom of treatment, and currently today we have 8 or more patients needing ICU beds than we have. So a gentleman from Clyburn, which was the reason for her query, died in Mississippi after they tried to find him an ICU bed after a simple coronary in 43 hospitals in the region. He was, by the time they found him a bed in Meridian, Mississippi, it was too late to save him. We've had the same incidents with people just needing simple procedures for cancer treatment. All elective surgeries are off. And so right now, the inequity that's affecting us is affecting everyone. So many people have negative experiences when they come to dealing with people of color. And the social determinants of health have historically prevented them from having fair and equal opportunities, economically, physical, and emotionally. So I'm wondering now, how can we not expect COVID to disproportionately affect us? We need fair access to health, it's mandatory, but it needs to address the lack of trust, as well as the social determinants that keep our people away at times. It's in the forefront right now. I don't know how long it will be there, but it's affected so many racial and ethnic minority groups and has increased our risk of getting sick and dying from COVID. We need public health policies and programs that center around the specific needs of the communities that can promote health equity. Oliver Leon Robinson Jr., born in 1960, retired American basketball player with the San Antonio Spurs from Birmingham. He was a Democratic member of the Alabama House of Representatives from 1998 to 2016. His district represented some of the most underserved areas in the state. In 2017, this well-known individual pleaded guilty to federal charges, bribery, conspiracy, tax evasion, after the IRS found that he had been paid to steer the Protection Agency, EPA's proposed fund, to add a Superfund site to his district. The lobbyists told him if they did that, they could leave their homes. And since many of them could not even sell their homes based on the value, he agreed and went out and made speeches, encouraging them not to have their houses included. In this area, cancer has plagued for decades. Majority of the ladies there have terminal breast cancer prior to age 32, when they can't even get a mammogram until age 40. Coal was used and stored there by the Drummond Company, who paid Mr. Robinson, Railroads at times would block access to and from the public housing areas, and there's train spills, carload spills, and we always have to evacuate people because of the environmental hazards that they live with. This is the largest public housing neighborhood, is overcrowded, and most people don't have transportation. If we look at the data from CDC, OMH, and MUSC, we can show that the neighborhoods and physical environments, the lack of access to quality health care, the lack of good occupations and job continues, and most of the people have a high debt to income ratio. And so they don't have high quality education programs and the jobs. We have a challenge in our clinics just adhering them to their blood pressure. So we knew when COVID came in, how these people would be affected. But we can change it by ensuring that we have the correct resources, assets, and accurate information from people of trust so people can maintain their mental and physical health. And I included these easy access to goods and services. Information from trusted sources. Most people don't even know about monoclonal antibodies, which when people first get infected, there's an option to keep them out of the hospitals. The cost of vaccines. Some people were charging people to get vaccinated. They didn't understand that. They had no insurance, even though they provided free. This information was not paying to them. And some people who were doing the testing was asking for income. So we need to quality respect medical and the mutual health services. And what happened to the state representative who had served for so long and was only sentenced in 2017? This picture is from last week. He's back on the golf course, hitting irons with some of the same people that corrupted him and lied to him, although he should have verified it. But he's back in the community, back on the golf course, and back being a favorite son. These are some of the teams that I'm a member of: the Region 4 COVID Equity Task Force, FEMA's Health Equity Task Force, the Liaison for Mass Care and Recovery, Preventive Health, FEMA Regional 4. I gave this to so many of them, but none of them are led by a person in the demographics they wish to serve. I sometimes get off of a call, a Zoom call, when a 22-year-old person who is not of color from Iowa is giving us messaging on how to reach our neighborhoods. And I really don't like to go into depth, but this is sort of profound to me. If you look at the non-Hispanic whites and the Hispanics, non-Hispanic blacks, and the disproportion that there's still today. Why still today? We should right now have the resources, the people in the neighborhoods, the people who have influence in the community heading up these. We've done things from Jackson, Mississippi to rural Georgia. They're always headed by someone outside the community, someone who's getting double hazard pay to serve us, someone that's young and asking a person at the table, did we reconstitute this correct? Is the temperature too high for us to give this injection? While the people in the line looking at them and shaking their head while they look on their cell phone to verify that they've got the right concentration of the vaccination. This is how, in my opinion, you do it. If you look at the top right, you can't read that little sign, but it's the catfish capital of the world. It's in Greensboro, Alabama, in our black belt, our famous black belt. And we can go there with the trust of the neighborhood elected officials, ministers, and our community partners. And where other people had gone and got a presentation from other people, they took 2,000 COVID tests for a town of maybe 8,000 people, but only 100 people showed up. When the local elected officials went and came and gave them door-to-door canvassing, then the entire neighborhood showed up, got tested, and got treated. So we partnered with the HBCUs. We did an initiative earlier this year where we were able to get free COVID testing through the student health centers. We started out with the students, but then we expanded into the surrounding neighborhoods so that we were able to do places like the Hyundai plant, Big Lots plant, where we're predominantly employed, underserved, and most of them, although they are full-time employed, do not have health insurance. And again, in the top left, we make it a family affair. The mother got it, and she told her then 13-year-old to get it, and hopefully soon the young ones will be able to get it if they have trust, rapport, and relationships with people who've been there for them. We partner with, at the bottom, with Made to Save, and did tours around the state. We had the First Lady in Atlanta, the First Gentleman in Birmingham and Montgomery, the Agriculture Secretary, and different people who had relationships and rapport. And we use the school boards. We're doing a pilot now in Birmingham so that when it's time, the students will be prepared, the parents will be prepared, and they know it's free, safe, effective from someone that cares about them. I have my questions and comments at the end, and I thank you for listening to the presentation.
Thank you, Dr. Ellis. Really, wow. I heard the importance of recognizing misinformation, the need to focus on health literacy and access, the impact of environmental hazards that made things worse. I loved your point about leveraging community assets. You know, go to the neighborhood, build trust, rapport, relationships. So thank you so much.
Thank you.
Next, we will go to Dr. Kim Lambert.
Good morning, everyone. That was a great presentation, Doctor. When we were in the green room, we basically said this is a hard subject to discuss. We know that there's no good news to share. But before I get into my presentation, I'd like to recognize Congressman Clyburn and a heartfelt thanks to Dr. Melinda Downing, Dr. Rivers, Lord Moore, as well as to the EJ Federal family that's been in this for a long time. So we'll go to slide number 1. And I'm going to be slide 2, please. I'm going to be brutally honest with you. I think as a federal worker, we have a tendency to tell the truth when we're gone. We don't say it while we're employed. Well, I'm going to give it to you brutally honest. Globally, yes, many were impacted. There's no dispute about that by COVID. We had a killing, raging virus machine that destroyed economics for many. Natural disasters just made the problems worse. And it left nations, honestly, scrambling for solutions. But what happened to those minorities out there? Well, there was gaps, major gaps in wealth, gender equality, the basic standards of living for many were destroyed. Race, health, EJ is closely tied to COVID-19. So go to the next slide, please. So let's talk about what has COVID done beyond the obvious. Well, it made the invisible visible. And there were certain bullets that came out that I extrapolated. There was a higher rate of health disparities and death, a sharp decline in life expectancy due to COVID-19. Matter of fact, it erased 10 plus years of progress in closing the death rate. And again, permanent damage and unattainable recovery on many fronts for many people. Next slide, please. Insult to injury. Now, when you look at race, you have many animosities out there. And we're just used to the old, well, race, color, and all. But there was a different attack going on. If the fires were burning, Asians were blamed for being responsible for COVID-19. And I think we have people from China here today, you can relate. Native Americans were insulted. They were told to go back to the reservations. And then Black and Hispanic workers was basically disrespected by entitled customers when asked to wear their mask appropriately in stores. Next slide, and now this is US data. Many of us have concluded all of this is inexcusable. I would say COVID will easily drag into 2022, easily. You know why? You only have 5% of the African populations vaccinated. When I speak of African populations, I'm talking about Africa. You have 50 countries that missed the COVID vaccine targets. But you may not see that a lot broadcast in the US news. Lower income countries are grappling with supply and health infrastructure issues. Now what happened? Well, the wealthier countries sealed deals with manufacturers while willfully neglecting the poor nations. What happened with that? Massive deaths. And don't forget, we got over 1 billion people that reside in slums. Next slide, please. And again, trying to struggle with what recommendations can I say at this point? Well, vaccine equity and scale up financial assistance. If those wealthier countries will share their supply with the poor nations, things will be better. And we honestly globally need transformational change. Invest in communities, not just jobs. Make those communities healthier. Next slide. And here are my personal final thoughts. The poor should not be disadvantaged. We are all the human race. Nobody cannot help if they're born poor. You have no control over that, but they're being punished. Could this COVID-19 and other viruses open doors to new solutions, reducing health disparities? Well, that's a question to think about. And what makes you hopeful about the future? If you're a minority and something else comes, can you be hopeful for you and your family? You better think twice. And as I mentioned before, COVID-19 brought the world to its knees. Healthier is not just about worrying about ourselves. We are one planet, one human race. So right now, I think in Montgomery County, it was told today in the news that they're gonna let down the mask. You don't have to wear the mask. Yet you have African countries that are dying in the streets. And we celebrate. I don't know how we can celebrate when we have minorities dying at a higher rate. And what is all this all about? It's institutional racism, permanently cemented. It really is. So we have institutional racism that is shown throughout the world. We have running buck wild, out of control. And to the federal family who is working hard to try to bring change, we have to continue to work harder. To the physicians that are working around the clock, to the grocery store worker, to nurses. When does it stop? So as the rich celebrate, and many of us are privileged, think about the poor. I believe, Carolyn, our slides will be uploaded later after this conference. And so you'll get to see those. But those that know me, I usually come with positive topics. There's absolutely nothing positive about this. Thank you.
Thank you, Dr. Lambert. So we heard Dr. Lambert, really the unvarnished truth. A couple of highlights. COVID-19 made the invisible visible, so we can't avoid it. Some of the impacts have taken us back, right? So things like erasing the 10+ years of closing the racial mortality rate. And I'd like, even though it was a tough topic and a lot of things that weren't going well, I heard what we should be thinking about. We should be thinking about vaccine equity. We should be taking a global view, not just our own country's view. We should focus on how do we really close the gap globally between poor countries and first world nations, and that the pandemic offers us a real opportunity to think about new solutions. So thank you again, Dr. Lambert. And then last but not least, Ms. Lathryn Woodard will share her thoughts.
Thank you. See if I can get my slides up here. While we're pulling my slides up, I do want to take the opportunity to thank all the organizers of this great conference. Although virtually it's still a great conference, but especially thank you to Congressman Clyburn. Congressman Clyburn is a visionary, but he's more than a visionary. He is a person of action. And just a sidebar, I've been around in this healthcare movement, public health included, for almost 40 years. And we talk a lot, we have the data, but we've got to show more movement. That's just my little personal soapbox. But to go on with my presentation, thank my previous panelists. You're going to hear a lot of similarities of what we've said in terms of dealing with health disparities and environmental justice, which I refer to as environmental injustices that we are going through. I am going to go from a different perspective, from the federally qualified health centers. Some of you may have heard of us, community health centers, federally qualified health centers. Federal qualified health centers are our reimbursement name, but community health centers they're nonprofit, community-owned businesses. And I need to set the scene first. When I was hearing about what was going to happen, I had this flashback when I started hearing about environmental justice and relating to health disparities. My flashback went to how the community health center movement started. And so I'm going to just quickly go through this for you. In this country, it started in 1964. And it was Dr. Jack Geiger, Count Gibson, Dr. Robert Smith, whose name is not on here, and also John Hatch from Chapel Hill. They were the founders of this model, which I'm going to briefly say because I don't have enough time to really tell you about the health center model, which is community-based and community-owned and community-run. Okay, the concept came out of South Africa, but the first grant that was funded in this country was funded through the Office of Economic Opportunity. Okay, talking about jobs, not healthcare. When I started working with the association, I went and found the first grant application written and just wanted to know what this was about because I came from DHEC, Public Health Department. So I pulled out some things, and this has been a while ago. I started working in '87 with health centers. So these slides you're seeing are since in the '80s. In the health center application, what really struck me was they talk about it included the social and environmental factors that affect health in communities. Okay, this is in the 60s. We're now 21st century, still talking about social and environmental factors that affect health. We just call them something different now. They're social determinants or social drivers of health, but we knew that back in the 60s. Next slide. Okay, my little technician. Okay. The first health centers that were funded was in Mississippi. Dr. Geiger and John Hatch and Robert Smith were, I know, the ones that were working at Mount Bayou, which is the Delta area in Mississippi. And then the other was Columbia Port in the Boston area. And I pulled this wording out because if you look at the bottom, it talk of the sentence really, it's talking about training local personnel, which is giving jobs, educating the people. I use the word training local personnel. You're teaching them to fish instead of giving them fish. But it's to stimulate the family and the community, the knowledge and their behavior for relating to the prevention of disease, the informed use of available resources in your community, which all are different, and which is what we're about, improvement of health, of environmental, economic, and educational factors related to health. Now, I'm in the health arena, and we have all these other arenas, and all of us should realize, in order for us to improve health, it's not just about dealing with other healthcare providers. And that's what we're talking about now. We need the environmental piece. We need education. We need the business community. We all need to be working together in our swim lanes to say, how do we address these disparities that have been going on for years? Okay, next. Now you're going to get more into my personal feelings on things. And this is what I was talking about with Clyburn. Be not hearers only. We need to take action and we need to be doers. We know what works. As I've been sitting on some committees, and I love to do community development work, and what I heard one gentleman say to this research group that was started this advisory group, he said, you know what? He was a older Black male, and he was a minister. He just kind of sat back and said, you know what? We kind of tired of y'all studying us. Can we get the services we need and stop studying and looking at it? We know what's wrong. And that led me to, when I was at DHEC, the statement that said, we were doing turning point, that it takes the wisdom of the community, it takes the professional expertise, which is people with the data and your research, because you do need to back up and make sure what you're doing is making a difference. And it takes political will. Adding those three together, you're going to get a healthier community, but not only a healthy community, you're going to improve the quality of life of people in those communities. And we need to be listening to the communities. The communities are the ones that are going to fix these issues, but we need to pay attention to what's going on in these communities. Now, yes, we have come a long way from when I first started working in healthcare, but we still are experiencing past factors that identified as contributors to inequity, such as social, named it environmental, health, education, economic. Next. This is my last slide, and this is something that I just believe in. When I started working with health center, I'm a very inquisitive type person. So when I started working with health centers and reading things, this just kind of hit me of we're in this country, milk and honey, land of the free, all those terms we use, but have we really progressed as a country? And this quote, the test of our progress, is not whether we add more to the abundance of those who have much. It is whether we provide enough for those who have too little. I took that to heart in terms of healthcare. We need to be bringing everybody up in terms of for quality healthcare. It doesn't matter what your socioeconomic status is, you still need healthcare. You can't learn unless you're healthy. You can't work unless you're healthy. So we see healthcare as fitting into all of this. The other thing I wanted to mention is that our health centers are all located in nationally, we have over 1,400 healthcare organizations with over 14,000 sites. And we were seeing 30 million, but because of COVID, we're now seeing 28 million people, our patients. But we are going to look at the visits because when COVID hit, we opened our doors to everybody, whether you were a patient or not. And our patients, of course, weren't coming in for safety reasons. But our health centers are located in medically underserved areas, and they're all nonprofits. They have gained the trust of the community. And the reason I say that is I saw when COVID put the floodlights, not spotlight, floodlights, it just kind of said, okay, y'all know all this was happening all the time. Now let me just show you how bad it is, how fragmented your health system is, how you act when there's an emergency situation. Who do you call? Who do you pull together? And we found going into medically underserved areas, rural areas, communities of color, some entities, and I'm not trying to cast into disparity or any group, but we all need to know our swim lanes. You don't get someone from Columbia, South Carolina, which is where I am, to go to Choppy, South Carolina, which is very rural in Georgetown, and say, with a mobile unit, we coming to test you or vaccinate you. And they look and say, who are you? Where were you when I needed help? So it is that trust in the community, but it is the voice of the community we need to be listening to. In terms of the environmental piece, we will never have a healthy community and bring in or close those gaps until we look at the environmental injustices that have occurred and still occurring. An example I want to give you is we have a health center in Spartanburg, South Carolina, and I work with the community up there. And we, and Harold Mitchell, who I understand is on one of the panels are speaking at this conference, people were having unusual sicknesses, including the cancers, that was like that many in this block area. Long story short, it's a Brownsfield. People didn't trust the public health department because they say, how did you let this happen? And we're sick. And so we went up, meaning my office, to talk to the community, to bring the professional expertise and talking to them, listening to them in terms of their wisdom of what do you think you need? What can we do for you? We talked about the healthcare, we talked about things, and they end up getting, with Harold's bringing in the environmental piece, of that is the first center in South Carolina that was funded because of the environmental health issues. Okay. One of the centers I ran our physician was very upset and came and sat down to me and just said, I'm just tired. I just saw defeat in her face. She said, I'm tired of treating these symptoms and we're not dealing with the root cause. And the root cause in this rural area that I ran a health center was water, polluted water, the wells. The kids were getting sick. Okay, these things, we know they contribute. And if we can put a man on the moon, why can't we together address these and get rid of these disparities? And I know all of you have seen, most of you have seen the picture that shows a fence baseball game going on in this fence. And when we used to talk about equality and all these kids, different heights, and you have these boxes that you gave all of them the same amount of boxes. Giving them the same amount of boxes to stand on was equality. They all got the same thing, but they didn't all start from the same place. You had some at different heights. Equity is when you give those who need more in order to bring them up. And that's what we do at our health centers. We're located in medically underserved areas. And when we provide health care with certified doctors, yes, they are real doctors who have a heart and passion for providing health care for everyone, quality health care. But what we also do is look at the whole person. We not only look at their environmental issues and those other social issues, we look at domestic issues, we look at housing issues. We also look at mental health and spiritual. We look at their culture. All those things have to come together. And, you know, I pray in my lifetime, I can see where all this stuff comes together and we are able to decrease, eliminate the disparities. My last point, because I don't know if keeping up with the time over here. Okay. Well, it's not my last point because I have more time. One of the things that I noticed with COVID, and it's not all, you know, some people are easy to first to say the people of color don't want to take the shot because of Tuskegee. Newsflash, a lot of the millennials don't know about Tuskegee. And to use the word, people are hesitant. They aren't really hesitant. You know, I say they're not hesitant. They are non-trusting. They don't understand. They have concerns about the whole process of being approved by FDA. And when I actually talk to some people, this is no way scientifically, okay? Talking to some people about, why aren't you taking the shot? You know, look at the people dying. This is a real thing. And this one gentleman who says, they rushed that process. I said, no, they hit every step of the process. He said, they may have hit every step, worked every night, but that part of actually watching how people react in that clinical trial was shortened. I want to wait to see. And didn't care who was taking the shot on news or anything. I want to wait to see what kind of side effects or what else can happen. That was the concern. Okay, that makes sense to me. So it was more of how do we talk to people? My grandson, I'm still talking. He has not taken the shot. Okay, he says, you don't know what it's going to do for you down the road. And I'm saying this because we can't send the same message out to everybody. Everyone has a different reason of why they aren't, how they are listening, understanding COVID. Misinformation, changing in information. Well, yes, information is changing because we're not used to this. As things change, our message to the community should be, after studying, going down the road, we are finding this, the variant came up. Those things for a lay person scares them. And we need to acknowledge that and don't look down on them because they don't understand that. Back to in terms of the environmental and social issues, I just feel that we've got to do more with how do we work together in our swim lanes and address what we have been doing in health centers a long time ago. And what I mean by that is, give you an example since I have time. Dr. Geiger, in the Delta area when he was providing care, one of the things he noticed, it was a food desert, the food insecurity. People weren't getting fresh food. So he had one child that was malnourished, and he wrote a prescription for food. Go to the grocery store. Okay, now y'all remember this back in the 60s, okay? The patient took the script, went to the local grocery, he knew Dr. Geiger, so he filled the script with the food that the patient needed, and it was listed on it. And the grocery owner billed the insurance company. Insurance company called Dr. Geiger, used some choice words as to what he was doing. And Dr. Geiger, and this is from Dr. Geiger, who recently passed. I think he passed 2019, he just passed. Dr. Geiger said he sat back and he told the insurance rep, whoever's talking, why do you write prescriptions? We write prescriptions to deal with whatever the problem is. Well, the problem was malnourishment. The answer to malnourishment is food. So yes, I wrote a script for food because that's what was needed. Then so we deal with food insecurities. Sidebar again, one thing that we've done, and I love to think out of the box, we've actually in some of our health centers partnered with the farmers market, that they bring their products in our parking lot to sell, because transportation is still a big issue in a lot of our rural areas of how do we get to places.
That is awesome. I am celebrating each of you and the knowledge that you've shared. Carolyn, should we wrap up or do we have time for one more?
We have 3 more minutes.
Okay, so this is lightning round and you all are all catalysts for action. So, okay, give me your one thing that you believe would help to promote more effective health literacy. Your one thing that would help to promote more effective health literacy. I'm going to start with Dr. Lambert.
I would say understanding and commitment and deliverables.
Understand.
We have
Okay.
Yeah, that would be my one thing.
All right. Dr. Ellison.
I think sensitivity and titrating the message to the people where they are part of it. People always talking about we going in this neighborhood and empower people. People are already empowered. You just don't respect it or honor it. So when you include them in the recipe, then the meal comes out better.
Thank you. And Ms. Woodard?
2 quick things. And I had to breathe when you said that with health literacy, because I know someone who died because of, we kept saying, because we have Hispanic patients too, we kept telling the one to take this pill once a day. ONCE is once, and she took 11 pills and died. Okay. So my thing is, we need to stop speaking clinical language and verbiage all the time and have people to repeat back in their tone, their words, to make sure. And it's not just the provider's responsibility. It's from the front desk to the back, asking the patient, what did you hear? If the patient repeats verbatim what is said, they didn't understand. Okay. And then the other is in training of our up and coming leaders. We need to cultivate our up and coming providers, up and coming healthcare administrators, up and coming champions in civil rights and whatever, that it is important that people understand, because if it's not informed informed decisions they can make if they are not understanding what you're saying. And don't assume everybody knows what you're saying, because I was one, I'm not the sharpest knife, but when you talk to a patient, and I was one, thought I had a heart attack, and they were doing stuff, and when I went to my cardiologist, he asked what did they do? I said, the heck if I know, I was praying to God that I go to heaven. I thought I was dying. So, it's having that navigator to a person with them. So I'm gonna stop, because that is a whole presentation I do, and how I'm very passionate about how we need to move ahead when we deal with health literacy.
Wonderful. Thank you, each of you, for sharing again your wisdom. If we were in person, I'd say big round of applause just for the work you're doing and the fact that you continue to be a voice for health equity. Thanks.
Absolutely.
Thank
Thank you, Karen.
Thank you.
Great job. Great job. Well, they can do their claps in the chat area. Thank you to all of you. Great job. Got us out right on time. This is the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We do have a 15-minute break that is scheduled, and we asked you to use that time wisely. We'll be back at 12 o'clock with our panel 2, and you're not going to want to miss the panel 2 that's coming up at 12. That will be addressing health disparities and environmental justice as part of the infrastructure rebuild. So you don't want to miss that. Special thanks to all our producers in the background. We know we had a couple of technical snafus. It happens in this virtual world, but we've managed to skate through those. As promised, if you go to the chat, there is a link to the video I referenced that Lathram was such a visionary in producing and deciding it needed to get done so that we could tell that story. So you can take time during the break and click onto the link and watch it as well. We'll be back again at the top of the hour so that we can get started with panel 2. Thanks so much, everybody.
Thank you.
Thank you.
Welcome back, everyone. I'm Carolyn Sawyer, and I am your facilitator for the 13th National Conference on Health Disparities and the 2021 National Environmental Justice Conference and Training Program. We're so happy to have you with us, and we hope that you enjoyed our first panel. We hope you had an opportunity to take in some amazing information and share some of that information with your colleagues, perhaps during the break. Our second panel is equally exciting. This is the panel that will be addressing health disparities and environmental justice as part of the infrastructure rebuild. This discussion is going to look at the efforts to rebuild our nation's failing infrastructure and the impact it will have on all citizens, with a keen focus on low-income, disadvantaged, minority, and Native American communities. So we're looking forward to getting into this discussion, and we've got the best person to lead us as the moderator for panel 2, and that is Dr. Laverne Ragster. Dr. Ragster is, what can I say? I mean, a real friend of this conference and has been a supporter, a longtime supporter of this conference. She is a retired professor, and she's from the University of the Virgin Islands, where she taught, and she is our friend in the VI, which we like to hold friends into the VI when it gets cold. So Dr. Ragster, we thank you so much for being with us and agreeing to moderate panel 2 today, and I'll let you take it away.
Thank you so much, Carolyn. It's a pleasure to see you again. I'm like everyone else. I'm sorry that we're not able to be in the same space this year. And so greetings to everyone. As Carolyn has just said, my name is Laverne Ragster, and I'm a retired professor of marine biology, actually, and president emerita at the University of the Virgin Islands. So I come to you today from a little tiny island way away from where all of you are sitting at the moment, most likely. I am pleased to have been and honored to have been a part of the National Conference on Health Disparities. I think I've done 12 years. So that's a good record, and I hope to do more. I want to thank, as everyone else has done, to thank Congressman Clyburn and also David Rivers and all of the members of the Planning Committee. This is a hard activity to put together, and this year it's been even It's required even more creativity and innovation. And thank you all. Thank you to our listening audience, all of the folks that are here listening with us today. And you'll have a chance to be very interactive because this panel is going to be different than we planned. I'm someone that speaks always about people from islands learning to live with uncertainty and having to be adaptable. Today's a good day to practice it. But today, I have the honor to serve as the moderator for panel 2. And we are going to be addressing health disparities and environmental justice as a part of the infrastructure rebuild. This is not a simple topic. None of the topics in this conference are. But certainly, when you bring these two large challenges together, you end up having to be very careful about how you come up with solutions. So this conversation is going to look at the efforts to rebuild our nation's failing infrastructure and the impact it will have on all citizens, especially with a focus on low-income, disadvantaged, minority and Native American communities. Now, when we speak about infrastructure, most people just think about the physical, the basic physical support that communities and regions and nations need to function. And you don't always think about what is important to change or to maintain when you have it, just because we sort of take it for granted. So I'm talking about roads and utilities, and actually schools fit in there, and lots of things fit in that area when we speak about infrastructure. So this is something that's been coming for the country for a long time, because in addition to having the loss of infrastructure because of aging, we've also had impacts because of our impacts from climate change. Think about it. Think about all of the new snowstorms, all of the new heat waves that we've been having, increases in our sea level rise, the cities trying to go under the water like Miami. You have to start asking, where will you put your roads? Where will you put your new infrastructure? The conversation we're going to have today is about how the decisions about infrastructure are going to be made. Who's going to be at the table? Okay, this always comes up when we speak about injustice and justice in this country. Who's going to be there? And what kind of underlying assumptions are we going to have regarding what is going to be expendable, what is less usable, what is less desirable to have? Minority people, people of color in this country have always had to fight to not be in those categories. So this conversation, I hope, will help you to see how we've looked at the problem and what kinds of things might be happening right now. There's an opportunity. How will we use it? Now, to help make this opportunity come to crystallize a little bit for you, we were supposed to have 3 members of this panel, but we are going to probably just have a conversation with one of them. But I'm going to introduce to you the person that is here and let you know that Mr. Milton Bluehouse Jr., who is the Deputy Chief of Staff for the Navajo Nation, associated with the Office of the President and the Vice President, and is in Arizona, is relatively new to his position. And at this time, he was scheduled to be here and is not able to be here. Then we also thought we would be speaking with the Honorable Harold Mitchell Jr., who's a former member of the South Carolina House of Representatives. He is associated with Regenesis, which is located in Spartanburg, South Carolina, and has an amazing track record of dealing with health disparities as well as environmental justice. He is also in transit at the moment and is not available to come online with us. So we thank both of them for having agreed to be here, because I have met them and they are amazing gentlemen, and I'm sorry you won't get a chance to speak with them. Who we will speak with today, though, is Mr. Derek Watchman. And maybe it'll be an opportunity for all of you folks in the audience that have all these questions. You can ask all of them to Mr. Watchman this afternoon. He is the president of Sagebrush Hill Group, which is located in Window Rock, Arizona. And I'm going to ask him to tell you a little bit more about the Sagebrush Hill Group and where they're located. That's really something that I think some people need to make sure they have in mind as we begin this conversation. Welcome, Mr. Watchman.
Thank you, Dr. Rexer, and it's my pleasure to be here. And so I just want to mention that Mr. Bluehouse was at the office of the president. He's in transit, and my understanding is he's now an associate professor at our local NEJC college, our Navajo college here on the reservation. So I think that's why he's unable to join us. But it's my pleasure to be here, and I'm in Arizona, so good morning to everybody. I am Derek Watchman. I'm actually a member of the Navajo Nation. I'm a tribal member, and my offices are in Window Rock, Arizona. And we did have a conversation this morning, Dr. Rexer, about where is Window Rock. Window Rock is actually the capital of the Navajo Nation here in Arizona. Our Indian reservation is roughly, as they say, the size of West Virginia. And so our land lies in Arizona, New Mexico, and Utah, and a little bit of part of Colorado. And so we as a tribal nation have the largest land base, Indian land base in the country. And as of probably a couple of months ago, we're noted as having the largest populated tribe in the country. And so, but my company is a professional service company. I've had a long career in being a gaming executive banker. I actually had some time where I worked for the Department of Energy. That's where I actually got involved with this National Conference on Health Disparities. And so, but my company, we have a team, and we specialize in actually assisting tribes, Indian tribes around the country. And so I spent a lot of time on energy, economic development, and basically, I think, Harvard had some huge projects called nation building for tribes. And so when I think about what I do, I'm actually involved in nation building. And so I'm not a tribal leader, but I've been close. I've been chief of staff for 2 Navajo presidents. And so it was an honor for me to be in the chair of actually helping to assist and achieve goals for 2 Navajo leaders. And so, but today I come before you as a member of the panel. I first got started with this health disparity and environmental justice about 20 years ago. In fact, we had a tribal environmental justice roundtable in Albuquerque, New Mexico. And a lot of issues that were raised then, I believe still continue today, and we can get into that. But today's topic is health disparities and environmental justice. And for me, I guess, I'll try to speak for Indian country, Native American tribes around the country. There's just by background, and a lot of people maybe don't see this, there are actually 574 federally recognized tribes here in America. And that basically, what that means is that there's a list that the Department of Interior has. And so every tribe has to be recognized by the federal government. And so there's 574 of us, Navajo Nation, included on that list. And we reside, I think, on roughly 300 reservations in this country, Indian reservations. And so we could probably talk days on reservations and what that means. And so, but for me, our reservation is like our state. Is someone? Did we get interrupted?
We have Representative Mitchell has been added into the conversation. Okay. He's on screen at the time, but he's now muted. Okay. So if you can hear me, Representative Mitchell, we're going to continue with Mr. Watchman. Are you able to stay with us for a while? Okay, great. We'll be back to you. So happy I was given Excuses for you. Good to see your face. My apologies, Mr. Watchman. Please continue. You were just beginning to get into how you are seeing this issue of health disparities and environmental justice come together in the rebuilding of our infrastructure for the Native Americans in the country.
Yeah, well, thank you. And trying to gather my thoughts here, there's a tremendous history, here in the United States relative to Native Americans. And so maybe stepping back a little bit, when this country was first created, there was a lot of connection with Native Americans in this country, and with the country growing, obviously a lot of exploitation, land grabbing. We were, I guess, the federal government decided to put us as Indians on reservations, and so in the 1800s, formal reservations were created. The United States government then entered into treaties. So there's a whole era of treaties between the United States government and Indian tribes in this country. And so, and then a lot of tribes had their style of government, but with the advent and the introduction of energy and resources, like my tribe, for example, the Navajo Nation. Our Navajo Nation Council, as I read, was actually formalized as we see it today. We were actually in 1922, if you will. The federal government said, okay, Navajo, you have to create a government. So we created a formal system. And the primary reason for that action was that it allowed for our Navajo people through our council to approve a huge energy lease. Because it turned out here on our Navajo reservation, we had an abundance of coal, oil, and natural gas. And so, so now we're in 2021, and there's a lot of reports out there that Indian country, and I say Indian country, but conditions on Native American reservations are very, very lax, way behind, 20, 30 years behind, as they say. And so with COVID-19 really devastated and impacted a lot of Indian communities, including here on the Navajo reservation. Because we're so far behind, infrastructure, none to speak of, limited water, limited roads, really increase the level of COVID-19 impacts. So on a proportional basis, our case level for the last couple of years was high relative to what we saw in America. And so the reasons for that is limited water, limited electricity, limited infrastructure. And so, now we have, some programs that are out there, like, for example, the CARES Act, in response to dealing with COVID-19, and then recently the American Rescue Plan Act. Those two federal bills carved out, and I'm glad to see this, carved out explicitly a considerable amount of funds for tribes. And so, like for example, on record, my Navajo Nation has benefited by about $2 billion in ARPA money to deal with the infrastructure deficiencies, to try to bring up to capacity, what's needed so that we don't continue to deal with COVID. But there was a study done here on Navajo, and the study basically said that here on Navajo, as an example, we're about 30 billion, and it's probably somewhere around the country, but we're about 30 billion behind in what's needed to get us up to par with what is considered national averages. And what I mean by that is that here on Navajo, we have probably 30,000 families that have limited forms of electricity. We have about 15,000 Navajo families that don't have running water. And so they have to go to a well for their water supplies. We have, on a reservation, I mentioned, we're the size of West Virginia. We have probably 10,000 or 5,000 miles of paved road. The balance is unpaved dirt roads. And so during inclement weather, challenges of transportation, getting our kids to school, and what have you. And so, but there's clearly, major health challenges in Indian country. For whatever reason, the level of diabetes is higher, heart conditions, obesity, as they say. And so, so today, I think we're at a point where perhaps federal assistance can make a difference. And so I'm happy to see, especially in the last 6 months, I'll say a true recognition of Native Americans here in this country. And for me, in the past, it was, if you look at funding, it's federal, state, and local entities. And so sometimes we were caught up as local entities. But now when I look at federal laws and federal legislations, it says federal, state, local, and Indian tribes. And I think that's a remarkable testament to our federal leadership acknowledging tribal government here in this country, recognizing that the way I look at it, a tribal government is almost like a state. We have our own laws, our own rules, our own systems. And so when you come here to Navajo, you're not governed by the states that I mentioned, Arizona, New Mexico, Utah, Colorado, or Arizona. You are in Navajo, on Navajo land and Navajo jurisdiction. But that brings a lot of responsibilities, and so so when you look at what's next and how do we address, like, for example, health disparities and environmental justice, what I hear from tribal leadership is we have to figure out how to partner with our federal agencies so that we can do this together. There is a unique relationship between the federal government and the tribes. And they label that there's trust responsibilities. I mentioned treaties. If you look at some of the wording in our treaties, for the most part, it says the United States government shall provide health, education, and welfare to Indians, Native Americans in this country. And I think that has got us this far. The next steps is how do we, as tribes, working with our partners, address the health disparities, as I mentioned. And so I know that there's some new issues that are coming up, like, for example, climate change, the whole carbon reduction program. Some of the work that I do right now is with tribes who actually got their start, like my tribe, got their start with benefiting from leases, royalties, and revenues from coal, oil, and natural gas. Now there's got to be a shift to move from those resources to renewable energy. And so how do you make that significant move from, like, for example, here on Navajo, we've been mining coal for 50 years. The coal has been mined and has produced electricity, which has benefited the Southwest. We as a tribe benefited from the royalties. Now that coal mining industry is going away. So what do we do as a nation to find a new revenue source to operate our government? If you look at governments around the country, the primary source of revenue is income taxes and property taxes. We don't have that type of system here on our reservation. And it's like that with many other reservations. And so, big challenges for our nation and other tribes around the country is how do you make that shift from being dependent on fossil types of energy and move it into renewable sources. And so, with the, for example, the infrastructure bill that's coming down, I think there's provisions in there to attempt to address and improve the roads on reservations, improve the schools, improve and try to address energy. How do you electrify reservations around the country? I could go on for days, but one example is, in the 1930s and the 40s, the rural electrification system that came down. If you look at the program of the RUS and how it was spent, basically the RUS program was a way to electrify rural America. But if you look at a map, you'll see these spots there that weren't addressed. Guess what? Those spots were Indian reservations. Indian reservations weren't included in the rural electrification system back in the 30s and the 40s. And that type of lack of addressing that probably goes to other types of services. And so, but I guess I'll stop there for a bit, Dr. Raxer. You know, I could go on for days, but and weeks. But you know, it's an honor to talk briefly about challenges for Native Americans here in the country. So, thank you.
Thank you very much. I have lots of questions for you, and I'm sure our audience does as well. And I ask them to please place your questions in the chat as we go along. And right now, we're going to have the opportunity to speak with the Honorable Harold Mitchell Jr. And we thank him for stopping in the middle of his travels to speak with us. As I said, he's a former member of the South Carolina House of Representatives and currently an executive director at the Regenesis group in Spartanburg, South Carolina. So, Mr. Mitchell, I am so happy to see you. And based on all of the things that you have done in your political and community activist career, I'm very interested in hearing what you have to say about how the infrastructure bill should address the issues that come up for us as communities of color regarding our health disparities as well as environmental justice.
Okay, and thank you for giving me this opportunity to present and share in this conversation. This year has been a trying time for the entire country. Are you able to hear me? I don't know if it's feedback. Am I okay?
I'm hearing you.
Okay.
I'm not seeing anybody shaking their head negatively.
Okay.
So please go ahead. We hope to hold the line on it. Please go ahead.
Okay. Well, as I was stating, though, this year has kind of, it's almost like hitting the reset button on much of what the environmental justice community and tribes, you know, you name it across the board, disadvantaged communities have talked about for decades with this pandemic and with George Floyd. Now, in saying all of that, I would say that too, having an administration that actually cares about the people of what we've seen for the past 4 years, and a commitment that we've seen to environmental justice from President Biden is reassuring as well. I can say as White House Environmental Justice Advisory Council that this is something that President Biden didn't just create this in a vacuum. This was something before many of the EJ leaders across the country even gave that support to him. He came, sat down, pulled a group across the country together to listen to find out exactly what were the problems and how could much of this be addressed in his administration. And before releasing any plans, listening to all of the leaders across the country, he came back and wanted to know if his team actually got it right during the transition before releasing a plan out to the public. And in this, that's where, you know, you look at the screening tool, the executive order, and the Justice 40 initiative, where President Biden has made that commitment of looking at the agencies across the board to invest in programs, resources into our disadvantaged communities, at least 40% of that investment. This is something that has never happened before. And I know a lot of folks are, you know, they're wanting that the switch to be flipped immediately. But this is something that, you know, we didn't get here overnight. But I just, you know, I'm glad to see that there is the type of commitment. And then not only, you know, that kind of commitment that he has made to environmental justice and climate, but creating a council of 26 members around the country, different regions, to continue to give that input and hold him and his administration accountable. Now, this is something, you know, it's kind of putting all the pieces in place of the rollbacks and the cuts that we've seen from the previous administration. You know, there's a lot that has to be put back in play, a lot of wrong that has taken place with the years of the, you know, systemic problems that we've seen in disadvantaged communities. But when you look at the commitment of not only EPA, but bringing all the agencies to the table and putting this under the CEQ, Center for Environmental Council on Environmental Quality, too many acronyms. You know, we see putting that there to where, you know, having Cecilia Martinez, Dr. Martinez, who's a grassroots person, frontline EJ leader, who's there at CEQ currently right now. You know, that's a voice, and she knows the people on the ground, knows the issues, and, you know, this continuation of having the conversations of looking at the red tape, the regulatory barriers, the things that have kept the investments from getting into communities and turning them into surviving communities rather than those that are thriving. And I say that, you know, when you look at this kind of commitment, and especially, you know, the other agencies, as was stated, the CARES Act, some of the acts, and even hoping out of this reconciliation package, those investments right now is what's being teed up, that I think you're going to see tremendous change in a lot of the communities around the country. It's also interesting to see that from a philanthropic side, we see a lot, whereas JP Morgan, Chase, a lot of the financial institutions that are investing now in social justice. Billions of dollars are being looked to be injected into communities. The resources where folks have always talked about, you know, needing to make these changes are now coming to the table. But it's where, when you look at, as was stated, COVID opened Pandora's box on a lot of what hadn't been done and invested into within our communities. And you could look at the zip codes to see those that tested positive the fastest and died the quickest. And even the long haulers, because I tested positive last August, went in the hospital twice, and, you know, it stuck with me for 65 days, and I'm considered one of the long haulers because of the effect of what, you know, is happening with my kidneys now. And so these are, you know, some of the things that we see where a lot of our communities that don't have access. And the great thing is that we have a director or an administrator there at HHS who has a background in environmental justice and an advocate, Javier, who's the secretary there. This whole thing about being able to connect the dots with disadvantaged communities is one that Congressman Clyburn and Bernie Sanders, with reauthorization for the federally qualified health centers, this is a program that's really a safety net for our communities to provide that kind of access to care for our folks, especially, you know, the disadvantaged communities. And this is something, even when you look at getting to the doctor's office, one of the things is looking at trying to get your prescriptions filled. Well, the 340B pharmacy program out of the federally qualified health centers discounts those prescription drugs at over 60%. So there's a lot that, you know, we can connect the dots of all the problems that we see. And with the investment, as was stated with the infrastructure, you know, this water infrastructure, there's a Flint, Michigan, just about in every state in the country because of poor conditions and not, you know, these lead pipes has been in the ground for 100+. That was meant to stay in the ground once you put it in. And so I think, you know, drinking these contaminated water lines, being able to replenish and remove that is going to be a tremendous help in a lot of our communities. And as was stated too, with our schools, you know, we saw, because in places like in South Carolina, broadband was an issue. Kids were out of school for a year. We were already 48th in education. So nobody could get up and go to McDonald's every morning and do their homework. And just think where we are now. And being able to make that kind of an investment back into our communities with broadband, not only broadband, but with telemedicine. You know, there's a lot that we saw that was uncovered during this year, and, you know, being, you know, trapped in for some time, mental health and behavioral health became huge problems that were already problems in our communities that we would not address. So, you know, when you look at the resiliency piece, nutrition, because there were many folks, you know, with these lines of trying to help feed people. And that's where I think too, with the Department of Ag, USDA, of what's going on right now with many of the programs that are out there. We see folks that are trying to create aquaponics and hydroponics to address the food systems and the you know, the shortages that we see, which falls into a renewable space. And that's one of the things that we're doing here, is that we're converting one of our landfills, a Superfund site, into a solar farm, that the chemical company will actually purchase the power in a power purchase agreement from the nonprofit, creating a real community benefit and a real community solar opportunity here in Spartanburg. But I would say that, you know, there's just a lot of opportunities right now, and with this administration, to be able to connect the dots on systemic problems that we've seen within our communities with these investments. The only thing is the implementation, because we do know that we have an obstructionist administration as far as the atmosphere right now in Washington. You know, we saw it with the American, the Recovery Act with President Obama. Those that made sure, tried to make sure that, you know, nothing was successful and those dots were not connected. And we know the same thing is going to happen now, because we have a midterm coming up. We have an African-American female that's the vice president that, in the southern red states of, in the deep South, these folks don't want to see the opportunity of a Black woman becoming president. So if you think that any of this is going to work and folks are going to welcome these resources in, we're mistaken. We still have work to do, but it's just, I'm very hopeful seeing that we have a president, an administration, and we still have people like Congressman Clyburn who's fighting to make sure that, these resources and things that, we've been missing for some time are finally being teed up. So it's basically up to us at this point to continue to move that and really fight during this midterm to keep control of the House, Senate. But we've got work to do. But I'm just hopeful for what has been teed up for us.
Wow. Thank you both. You have put on the table some of the big issues regarding the fact that we see positive change in terms of the country receiving more investment, more support from the federal government, and the importance of that. I heard both of you speaking about the need for outreach to your communities and stakeholders that are being impacted while you're developing policies and actually moving forward with changes. I think at this point we're going to have questions put into the chat, and I have one from, I need to get it here. All right, so from Sharon Beard, thank you. How do we ensure that funding goes to existing and successful local programs? Anybody wants to start?
Yeah, I'll jump in and
okay, please go ahead.
I know he'll do the cleanup for me. But one of the things that we tried to do in the beginning was that when Congressman Clyburn helped us in South Carolina with the ERA dollars, our governor refused to take those dollars, and Congressman Clyburn gave him 45 days. And if he accepted Mark Sanford, the General Assembly had the opportunity to create a resolution to pull those dollars in. And looking at that, I saw we were going to have the same problem and met with members in South Carolina to create a Justice 40 oversight committee. And in this, it's giving the kind of oversight, accountability, and transparency to actually look at those resources to connect, from the federal government to the regions and state down to that local level. That's something that is not in place. And that's why I say, there's this interim guidance that President Biden has right now. It's called interim because there's still a work in progress. And this is where right now we know that we have to be able to connect the dots and keep all sides accountable, because we know that in some cases we've seen in South Carolina already where there are directors that have tried to take some of the CARES dollars, and they're claiming that we do see climate change, we see the rising sea levels, but we need $40 million for beach renourishment at Hilton Head. And so there's going to be the abuse if, the guardrails are not put in place and the teeth are not put in by Congress and some of these agencies. There's going to be that abuse when you have this kind of money that's going out and this kind of attention. So everybody's going to try to make their priorities.
Okay, no, thank you. I do agree with you that there's a need for a way to try to make sure that if we have investment, that that whole business of accountability and transparency are absolutely critical. And unfortunately, there's going to be a need for more lawyers. Mr. Watchman.
Well, I think speaking for Indian country and tribal government, before COVID, before this wave of federal dollars, I think a lot of our tribal governments just didn't have enough technical capacity to run the current programs, and so now you have this wave of additional federal investment dollars, and so I think it's challenging our tribal governments to get up to speed to run their current programs and also run with the new monies that are coming in. And so I'm seeing a lot of requests for tribes to hire outside lawyers, as you mentioned, CPA firms, so that obviously they're accountable and they meet the interim guidelines that are out there. One thing though that has come to mind is that as Indians, we're also citizens and members of states. And so when you look at the state allocations of these federal assistance dollars, some of that also is earmarked for tribes. So I think it's incumbent upon our local states and our tribes to work together to funnel those dollars that go through the states to the tribes. I know some states are saying, well, tribes already got a carve out in all these federal programs, but we also have to remember, like for me here in Arizona, I'm a citizen of the Navajo Nation, but I'm also a citizen of the state of Arizona. So I'm also entitled, my tribe is also entitled to a portion of those funds that go to the state. And so I think it's incumbent upon our state officials to recognize that Native Americans in their state also should get a cut of the pie. And then hopefully that goes to address what I think, as I stated earlier, Indian country is so far behind that any and every dollar in assistance and investments is needed and will be needed. So I'm hoping that we can. I'm hoping, and I always encourage the tribes to not only reach out to the feds, but also to our state officials. Because the term that I heard is that we're co-citizens, we're dual citizens, and so it's something unique. So we got to recognize that and push that.
Okay, well, I have a follow-up to that, and then I have another question for you, Mr. Watchman. And my concern is that I hear both you and Representative Mitchell speaking about policymakers, about organizations. Where is the role for the community and the individual citizen? Because if the conditions are, as you both have stated, and I completely concur, then the true watchdog is really the individual citizen, because clearly there are people just breaking the rules because they can. So either you have to have a lot of money to be able to stop them, or you have to have the voice of people and use it in many areas. So where do you feel that you have that voice in your in the Native American community? I'm going to ask you the same question, Mr. Mitchell. Do you think you can you see the people that you are trying to help and protect? Do you see them figuring out how they can enter into these processes?
That's an interesting question, and I've been dealing with it from the small business perspective. My company is a small business, and so I've asked our tribal leadership, how is the business community going to be benefiting from these dollars? And so we've been trying to lend a voice to our tribal leadership, but I have to hand it to our Navajo leadership. They went out and had public hearings and discussions and saying, these monies are coming down the pipeline. So they're getting feedback from tribal members. And I think I've seen that with other reservations and our brothers and sisters on other tribes. And so for the most part, they've been trying to gather information. But mind you, a lot of Indian country is still locked down. A lot of tribes are not allowing visitors. And so basically a lot of meetings are still by Zoom. Some parts of the country are opening up, but especially the smaller reservations, they're just worried about, inviting and having public meetings, and they don't want to continue or increase the spread of COVID. And
Absolutely.
so that's bringing, a lot of challenges with garnering feedback from our tribal citizens and members. But here, it is happening. It could be better, but there is the system for our members of our tribes, as I see it, to voice their opinions to their leadership. It's happening. Yeah.
No, thank you. What do you feel? How do you feel about that, Mr. Representative Mitchell?
It's key and very important, and it's a big piece of community engagement and community involvement, and you have to have that. I mean, without it, it's pretty much why we're in the position that we're in right now. When you look at the lack of capital investment, first and foremost, that's why, we have this problem that we have of these silos of social justice, economic justice, environmental justice, climate justice. We've allowed other people to carry that narrative and keep us divided and keep us away from the table. And so that's why I said I'm hopeful now, because what the president has actually done is pull this White House Environmental Justice Advisory Council made up of frontline members around the country. But from that, we know that we still have to have these conversations, across the country in many different regions, because a lot of this is so new. It's even new to a lot of the agencies themselves. When you look at a particular agency and what they have in their toolbox, the resources, I mean, hell, half of the folks that work for an agency don't even know the initiatives and programs. So let alone, how are you going to expect people on the ground who don't do this every day to know that exact same thing? So that's why it's important to, from a point of education, I think that's something that the education, outreach, technical assistance, and a lot of what some of our colleges and universities are doing. In Spartanburg, how we were able to leverage a $20,000 small grant into $300 million, it didn't come from the federal government alone. If it were not for Texas Southern University and Howard University, we wouldn't have our federally qualified health center. We have to learn how to use the tools that's available and leverage, because everybody's not going to get a federal grant. But there are so many opportunities that are out there. The colleges and universities, they're looking for laboratories like many of these disadvantaged communities that could really be more beneficial than some of the grants that are being awarded. So I think it's really a part now of connecting the dots. And that's where folks on the ground have to hold people accountable, because just like, as I mentioned, that ERA money, when Mark Sanford didn't pull it down and Nikki Haley didn't want to expand Medicaid, well, what happened in South Carolina? We had rural hospitals shutting down, people dying, and no one said a word. So, who's going to hold who accountable? I mean, it's time for us to, we've got to step up, and either the show horses got to be removed and put some workhorses into place to represent. Because, I mean, if you look at it, hell, the Tea Party stole our playbook and removed everybody trying to dismantle the Affordable Care Act. Why can't we do it? We created it. I mean, it's time for accountability and stop pointing the finger. We have some of the tools. Yes, it's rough. I'm in the same predicament with narratives that we see now that close to 8, I don't know if it's 8 or over 800,000 people that have died. And we still have people saying that this virus isn't real. We have the least of these kids that can't be protected because we have people with their whatever you want to call it, blocking that. And I saw the same thing even with well, I'll shut up with that, man. I'm sorry.
I hear the passion and the concern. Let me ask, we have another no more than 10 minutes, but let me ask you, Mr. Watchman, how is the Navajo Nation addressing lack of water and sanitation infrastructure and uranium contamination issues? So this is a configuration of all of these things.
Those are two great questions, or two great topic areas, and I know that our nation's leadership, even today, are talking about, how do you improve the water infrastructure system on a reservation? The challenge that we're having is that the Southwest is experiencing a severe drought. And so now we have challenges with water rights, and to what degree does now a nation have access to the San Juan River and other tributaries in our area. But our nation's leadership is working with our utility authority to identify those areas that need water, and so they're putting plans in place. The challenge is the capacity. We have to basically go on the outside to bring contractors in, and so what I've been saying is that we have to basically, in terms of investment, we need to address the water deficiency, but also hire our own businesses, so that helps improve economic development and helps improve and grows our nation here in Arizona. On the uranium side, that one is a whole can of worms in of itself. In our area, there's an abundance of uranium resources. And so we were actually a part of the whole Cold War system. Uranium mining was big back in the 50s and 60s. And so, but after the Cold War ended, basically the federal government and the military basically just left these mines unaddressed, abandoned. And so here on Navajo, we have roughly 500 abandoned uranium mines. And so in many cases, those mines weren't closed or marked. And so we had a lot of families move real close to these mines. And so as a result, we have a lot of contamination going on with our animals, our plants, our homes and infrastructure. And so it's causing obviously a lot of health issues. Uranium contamination certainly has impacted many of our Navajos. And so out of the 500 mines, half of them are being addressed to a certain degree. The other half, as I'm hearing, is about 250, maybe 300. There's no resources behind it to address that. So today we have abandoned mines that are easily accessible. And so, our nation is working with leadership in DC with the new administrator EPA to figure out how to address and finance the assessment and cleanup of these 300 mines. And so it's in the works, but it's going to take a long time. We were a part of the uranium legacy, and so hopefully they'll continue with the uranium legacy to clean up the Navajo Nation. And so, but I would like to add that, in terms of leadership and involving our community, I think I'm remiss by not acknowledging Secretary Deb Haaland, our first Native American as a cabinet secretary. And so she's from New Mexico and does wonders and has really addressed and really brought to bear tribes and Indian countries. So, my heartfelt congratulations to her and the work that she's doing as the head of the Department of Interior, which the Interior has the noted Bureau of Indian Affairs. And so she's in charge of that, doing great work. And so I know her quite well, and so I'm glad that she's doing great work for all of us, including tribes in this country. So
thank you. We have just a few minutes left. So let me ask if you would give brief responses to this, I would appreciate. So this question is, very often the line of communication is via the church community centers or schools, other organizations for youth. Have any of the speakers, either of you, found other magic answers, and magic answers is in quotes, for reaching out and lending an ear to the environmental justice communities, especially tribal communities? So do you think that there are some other organizations, other approaches that will work with respect to getting the word out regarding the conditions that people are living under and the things that need to be addressed? Mr. Mitchell, would you go ahead, and then after Mr. Watchman speaks, we'll probably have to close out.
Okay. Yes, ma'am. I would say yes, and we have to have, especially the faith community. The faith community is the backbone, and when you look at, the different movements, it was the church and the faith that actually pull our folks together. So we can't disconnect anything that brought us to where we are, and we have to have everybody at this point, because where we're moving to, and as you stated, Mr. Watchman, I mean, it's it's a breath of fresh air to have people, competent people in positions, like you stated with Deb, because I served with her on the Climate Council, and having people like that in positions of power makes a difference. It's not like we saw in the previous administration of a brilliant brain surgeon running HUD. So, so it's like, we have competency, and that's what I'm, hopeful, that's going to take us through, but it's going to take efforts too. Like, I know I give David Rivers a hard time a lot, but, this conference and this conversation itself, we have to have more of these conversations, because, we can't allow or wait on somebody else to deliver this message, because they were already distorting the Justice 40 initiative that's monumental in itself to our community. So we have to have our own voice, and we have to educate and get people to really understand all the components that's making this transformation possible to the people.
Okay, thank you so much. Could you briefly indicate if you can think if there are any other ways of getting through to getting the word out regarding the conditions that people are living under?
Well, I mean, I think that there are a lot of, were you still asking me that, or was it?
No, I'm sorry.
Oh,
this is a very bad habit of being on any platform like this. I'm looking at Mr. Watchman.
Oh, okay.
As we're standing up with each other. I apologize.
I'm sorry, Mr. Watchman.
No, Mr. Mitchell, you're doing a great job, but in Indian country and reservations, we do have churches, but here on Navajo, we also have our Navajo culture, and we follow that, and so we have our ways, and so we have a variety of faith-based types of entities, and so but they're all working hand in hand to advance the challenge that we need. What I'm also seeing on many reservations here on Navajo are local, organized, and here on Navajo, grassroots Navajo organizations. There's one that has really done a good job of highlighting and addressing, the negative impacts of coal mining that has happened here on our reservation. On the positive side, coal mining has provided revenue and jobs, but it has devastated our water supplies, has contaminated and polluted our air, and so the local Navajo grassroots entities have done a great job in highlighting and bringing to bear the impacts. And so now the next question is, what's next, and how do we? And I appreciate Mr. Mitchell saying we have to, on our own, work with our federal partners and state partners to address these problems. And so, for me, our people, my people, we have to, pull our boots by the bootstraps and work together and help solve the problem with everybody else. And so I think in the past, because of the treaties, it's the treaties say that we'll get this and that, but we have to also, with our highly capable, talented people, work hand in hand with our partners, and that's everybody off the reservation, to address these issues.
Thank you. Gentlemen, it always works like this. We never have enough time. So I want to thank you both for a very engaging conversation, and I hope you have helped our audience to see things from a different perspective. I'd like to make sure we thank all of the conference participants for their engagement as well and for participating. And I would like to say thank you to the organizers of this conference and wish everyone a wonderful day. This concludes our session. Thank you.
Thank you.
Thank you very much.
Thank you.
Dr. Axter, thank you so much for being a fabulous moderator of this panel 2 today. And I hope you all got some wonderful information. We had some great interaction. We thank those individuals who sent in questions that you had regarding this topic. We asked you to invite you to stay tuned. I have a couple of housekeeping notes for you. I am told that the entire recording of today's session will be posted online this evening. And so you can go to either website to check that information out. And I want to remind you that on tomorrow, we will be starting at 9:30 a.m. again. And so you want to be prepared for that as well. Tomorrow, we've got a full day, panel 3, which will talk about the evolving crisis of disparities in the recognition of and access to treatment of mental health. Big topic that a lot of people are discussing these days. And then we're going to look at climate change and climate justice on panel 4. And then with panel 5, we'll be looking at the topic of Title 6 and environmental justice. So you're not going to want to miss any of this on tomorrow. We want you to be ready and tuned in and ready to go at 9:30 in the morning tomorrow. So thank you for being a fabulous audience today. We appreciate you bearing with us, but we know that you got some great information and we look forward to you being back on tomorrow. Until then, I'm Carolyn Sawyer, your conference facilitator, and I'll see you in the morning.